Okay, so good morning to all of you. Good morning to all of you. Let us start with the first MCQ. Good morning, good morning. So I am Dr. Pradeep Pawar, Professor of Anatomy, a vast teaching experience. We'll start with this. The following arteries are branches of celiac trunk, except yes, students, you can answer this. Let it be an interactive session. Yes, the inferior pancreatico-duodenal. Inferior pancreatico-duodenal is the first branch of superior mesenteric artery. It's the first branch of superior mesenteric artery. That's inferior pancreatico-duodenal. Just to brief you, tell me. Just one moment. Okay, I'll start. Tell me, celiac trunk gives three main branches. What are those? Celiac trunk gives three main branches. One is the left gastric, second splenic, and third is common hepatic artery. Left gastric, splenic, and common hepatic artery. The splenic artery runs on the superior border of the body of the pancreas, correct? It runs on the superior border of the body of the pancreas. So on its way, it gives branches to the pancreas. We call this as the pancreatic branches, pancreatic branches. It gives branches to supply the fundus of the stomach. What do you call this as? The short gastric branches, short gastric branches. And it gives an artery which supplies the greater curvature of the stomach. What is that? That's the left gastroepiploic artery. Left gastroepiploic artery. So what are the branches of splenic artery? One would be the pancreatic branches, second are the short gastric branches, and the third one is the left gastroepiploic artery. The common hepatic gives further three branches. One is the right gastric artery, right gastric. Second is the gastroduodenal, and the artery which is left would now go to the liver. It is now known as the hepatic artery proper. Hepatic artery proper. Now this hepatic artery proper would go to the liver. The gastroduodenal artery would further give two branches. One is the, yes, this is the the gastroduodenal artery will give two branches. Yes, what is this? One is the right gastroepiploic artery, right gastroepiploic, and the second one is the superior pancreatico-duodenal artery, right gastroepiploic and the superior pancreatico-duodenal artery. Okay, so this is about the celiac trunk. Tell me now, this hepatic artery proper is going to the liver. Any structure going towards the liver or coming from the liver, it has to pass through a fold of peritoneum which lies between the liver and the stomach. Can you answer this? There's a fold of peritoneum which lies between the liver and the stomach. What is this fold of peritoneum known as? Lesser omentum. Lesser omentum. So now, ये जो artery होगा, hepatic artery proper, it has to go to the liver. So as it goes to the liver, it has to pass through the lesser omentum. Any structure, if it has to go to the liver or come from the liver, it has to go through the lesser omentum. So now you tell me, students, there are three structures which are lying within the lesser omentum. What are those three structures? One is the hepatic artery. Second, answer this. Structures lying within the lesser omentum, I'm asking. One is the hepatic artery which is going towards the liver. Second is a vein, portal vein, and the third one is the bile duct. Hepatic artery, portal vein, and bile duct. These are the three structures which are present within the lesser omentum. ठीक है? And ये तीनों का एक specific sequence होता है. They're just not randomly arranged. They're just not random. They have got a specific sequence. Can you tell me, students, out of these three structures, hepatic artery, portal vein, and bile duct, who's the most posterior? सबसे पीछे कौन होता है? सबसे पीछे is the portal vein. सबसे पीछे portal vein होती है. who's to the left of the portal vein? Who's to the left of the portal vein? That's the hepatic artery. And who's to the right of the portal vein? That's the bile duct. Okay, so this is anterior I've drawn and this is posterior. So these three structures are present within the lesser omentum. Okay, these are present within the lesser omentum like this, and within the lesser omentum, hepatic artery, portal vein, bile duct. सबसे पीछे होता है ये portal vein. To the right of the portal vein is the bile duct, and to the left of the portal vein is the hepatic artery. Just remember this sequence. Okay. Quickly tell me, what are the branches of What are the branches of superior mesenteric artery? Can you enumerate the branches of superior mesenteric artery? Branches of superior mesenteric artery. Start. 1. The first branch. The first branch of superior mesenteric artery is... Yes, students, answer. The first branch of superior mesenteric artery is inferior pancreaticoduodenal artery. Okay, it's not visible. Okay, so the first branch of superior mesenteric artery. Yes, anyone answer this? I'll put a screen for you. Inferior pancreaticoduodenal artery. Inferior pancreaticoduodenal. Second is jejunal and ileal branches. Jejunal and ileal branches. Inferior pancreaticoduodenal, jejunal and ileal branches. Then the next artery is middle colic, right colic, and ileocolic. So these are the branches of superior mesenteric artery. Superior mesenteric artery. Remember this. So superior mesenteric artery gives inferior pancreaticoduodenal, jejunal and ileal branches, middle colic, right colic, ileocolic. Middle colic, right colic, and ileocolic. Ileocolic gives two branches. One is ascending branch and the descending branch. Ascending and descending branch. Descending branch of ileocolic gives four branches. One is anterior cecal, posterior cecal, appendicular, and ileal. Appendicular and ileal. So what is very important here is appendicular artery. Students, appendicular artery is a branch of what? Appendicular artery is a branch of the descending branch of ileocolic. Descending branch of ileocolic. That's appendicular artery. That's a branch of descending branch of ileocolic. So these are the branches of superior mesenteric. Clear to all of you? Inferior pancreaticoduodenal, the jejunal and ileal branches, the middle colic, the right colic, the ileocolic. Fine. And the last one, inferior mesenteric artery. What are the branches of inferior mesenteric artery? That's the left colic branches, sigmoid branches, sigmoid, and the third one is superior rectal artery. Superior rectal artery. Superior rectal artery is a continuation of inferior mesenteric artery. Remember this, superior mesenteric is a continuation, a superior rectal artery is a continuation of inferior mesenteric artery. So this I've completed all the... Okay, fine. I'll put a black pen for you. Fine. Clear to all of you? So inferior mesenteric gives left colic, the sigmoid branches, and it continues as the superior rectal artery. Fine. So this is about. So we finished the branches of the entire the GIT, the celiac trunk, the superior mesenteric, and the inferior mesenteric arteries. Clear to all of you? Fine. That's it. So answer is A for this. A. Superior pancreatic, inferior pancreaticoduodenal. Coming to the next one. Answer this MCQ. Trachea is lined by one of the following epithelium. Trachea is lined by one of the following epithelium. Answer this, students. Trachea is lined by one of the following epithelium. Anyone? Come on students. What is respiratory epithelium? Respiratory epithelium. Transitional नहीं है बच्चा, transitional नहीं है. Trachea is not lined by transitional. Just one moment. I just need the charger. One moment. There is no transitional epithelium. Trachea is not lined by transitional. Students, what is the epithelium of the trachea? Okay, got it. So tell me, what is the epithelium of the trachea? That's pseudostratified ciliated columnar. You should know this. The epithelium of trachea is pseudostratified ciliated columnar with goblet cells. Pseudostratified ciliated columnar with goblet cells. That's the epithelium of trachea. Where do you get transitional epithelium? Anyone transitional epithelium is seen in? Yes, the urinary system. That is known as urothelium. So epithelium we classify into two types. One is simple epithelium. Just a quick go through it. Simple epithelium and stratified epithelium. Simple epithelium and stratified epithelium. Tell me now, students, simple epithelium, what does that mean? Simple epithelium and stratified. Simple epithelium मतलब क्या होता है? All the cells are resting on what? Basement membrane, right? All the cells are resting on the basement membrane. So this is simple epithelium. And stratified मतलब there are multi-layered of cells. Multi-layered cells होते हैं. All the cells do not rest on the basement membrane. Are you clear? So simple epithelium में only one layer of cells. All the cells are resting on the basement membrane. So simple epithelium will be present where there's exchange of gases, secretions, absorption functions. Stratified epithelium multi-layered होता है. So ये कहाँ पे होगा? Where there's lot of friction. So the topmost cells will keep on dying and the lower cells will form new cells. Okay, so this is what is stratified. Now simple epithelium is of three types. It's simple squamous, simple cuboidal, and simple columnar. Simple squamous, simple cuboidal, simple columnar. Tell me students, what is the example of simple squamous epithelium? Chalo, let it be an interactive session. Come on students, what is the example of simple squamous epithelium? Where do you get the simple squamous epithelium? Simple squamous. You get this in alveolus. You get this in blood vessels. Alveolus, blood vessels, yes. Where do you get simple cuboidal epithelium? Anyone? Simple cuboidal epithelium. You get this in? Simple cuboidal epithelium is found in PCT, DCT, proximal convoluted tubule, the distal convoluted tubule, the thyroid follicles, thyroid gland, thyroid follicles, you get simple cuboidal epithelium. Simple columnar epithelium you get in the GIT. Okay, so simple squamous epithelium lining the alveolus, lining the blood vessels. Simple cuboidal epithelium is PCT, DCT, the thyroid gland, and simple columnar we get in the GIT. Stratified epithelium is again of three types: stratified squamous, stratified cuboidal, and stratified columnar. Stratified squamous is of two types: stratified squamous keratinized and non-keratinized. Stratified squamous keratinized is found in the skin. Stratified squamous non-keratinized. Yes, answer this. This is an MCQ for you. Where do you get a stratified squamous non-keratinized epithelium? You get this in esophagus. Esophagus, you get this in the vagina. Esophagus, vagina. This is stratified squamous non-keratinized epithelium. Stratified cuboidal and columnar we get in the ducts of the glands. Okay, ducts of the glands. The third type of epithelium is pseudostratified ciliated columnar. It's stratified only, but it is not actually stratified. It looks stratified. Pseudostratified ciliated columnar epithelium, that's a characteristic of respiratory epithelium. Pseudostratified ciliated columnar. And the last one is transitional epithelium. Transitional epithelium is found in urinary system, urinary tract, the urothelium. Chalo students, answer this now. What is this pointed structure? What is this pointed structure? Okay, come on. What is this pointed structure? Anyone? Anyone? So what have we opened here? We opened the right atrium. We've opened the right atrium here. We've opened the right atrium. What is this structure? No. It's not bicuspid likha hai? Nahi, it's not bicuspid, Ankita. No. It's not bicuspid. Okay, look, I'll tell you. Just one moment. So you tell me a line joining the SVC to IVC from outside. Kya bolte ho? A line joining the SVC to IVC from outside is known as what? That is sulcus terminalis. Sulcus terminalis वो line होता है which joins the SVC to IVC from बाहर से, outside. अब the same line from inside is known as what? जो अंदर से होगा, that line is known as crista terminalis. And this crista terminalis is going to divide the right atrium. This is the right atrium. The crista terminalis divides the right atrium into two halves. This is the rough part and this is the smooth part of the right atrium. ये smooth part है, ये rough part है. The smooth part shows structures similar to teeth of a comb. Teeth of a comb. The rough part shows structures similar to teeth of a comb. What is this known as? Musculae pectinati. Musculae pectinati. The smooth part of the right atrium shows three openings. One, identify this. What is this opening of SVC? What is this opening of IVC? And what is this opening of? This is the opening of coronary sinus. Coronary sinus. So smooth part में तीन openings होते हैं. This is the opening of SVC. That's the opening of IVC, and that's the opening of coronary sinus. Students, the opening of IVC is guarded by a valve. यहाँ पे एक valve होता है. Answer this. What is the name of this valve? This you should know. This is a very important MCQ. The opening of IVC, there's a valve there. Name? Anyone? Can you identify this valve? This valve is known as the Eustachian valve. Eustachian valve. Very good. And the opening of coronary sinus, यहाँ पे एक valve होता है. इसका नाम है Thebatian valve. Thebatian valve. Just remember this. So Eustachian valve, Thebatian valve. Clear? Fine. Now, this is the right atrium. ये जो chamber है, this cavity is the right atrium. Who's on that side? That side. Who's on the other side? Left atrium. On that side would be the left atrium. What is this now? This is the interatrial septum. That's the interatrial septum. What is this depression known as? Students, answer. What is this depression known as? Anyone? ये interatrial septum है. What is this depression in the interatrial septum known as? You should know this, and this is very important. बोलो बच्चों. This is the fossa ovalis. ये है fossa ovalis. And what is this here? This is the limbus fossa ovalis. ये जो elevation देख रहे हो, this elevation above the fossa ovalis, this is what we call as the limbus fossa ovalis. Limbus fossa ovalis. And this fossa ovalis is represented by whom? Septum primum. Septum primum. And the limbus fossa ovalis is represented by whom? Septum secundum. ये याद रखना. Fossa ovalis is represented by septum primum. जो septum primum है वो fossa ovalis को represent करेगा. And the limbus fossa ovalis is represented by septum secundum. Perfect. Now you tell me, students, this is the right atrium. अब यहाँ से नीचे जाते, we go down. What is that chamber below the right atrium? Right ventricle. इसके नीचे होगा right ventricle. What is this valve? What is this valve? There are three cusps. Tricuspid valve. ये है tricuspid valve. ये एक cusp है. That's the second cusp. And here would be the third cusp. तीन leaflets होता है ना, leaflets. So this is one leaflet or one cusp of the tricuspid valve. Second, the opening of coronary sinus. Opening of coronary sinus. And what is this elevation known as? This elevation is known as the tendon of Todaro. Tendon of Todaro. Anyone knows what is this? This is the tendon of Todaro. Tendon of Todaro. ये जो ridge है ना, this elevation is known as the tendon of Todaro. So now we get a triangle here. We get a triangle here. Can anyone identify what is this triangle known as? Students, tell me. What is this triangle known as? This is known as the triangle of Koch. Triangle of Koch. And who lies in this triangle? In this triangle lies the AV node. AV node. Triangle of Koch. And who lies in this triangle? The AV node. What are the boundaries of this triangle? I'll tell you. Because if I start writing now, then student starts to go here and there. Okay, I'll just tell you. Aap likh lo. So what are the boundaries of this triangle of Koch? 1. Triangle of Koch के boundaries आप लिख रहे हो. Triangle of Koch. Boundaries. 1. The septal leaflet of the tricuspid valve. Yeah, na, leaflet which is attached to the septum. Septal leaflet of the tricuspid valve. एक leaflet, septal leaflet of the tricuspid valve. 2nd, opening of the coronary sinus. Opening of the coronary sinus. And 3rd is the tendon of Todaro. Tendon of Todaro. Todaro. So this is what we call as triangle of Koch. Is this perfect, students? What lies in this triangle is AV node. एक दूसरा MCQ और दूसरा option which is always asked in the MCQs. Where does the SA node lie? Where does the SA node lie? The SA node lies at the junction of SVC with right atrium. वो junction पे होता है SA node. हाँ, you can just mention this in your notebook. SA node lies at the junction of SA node lies at the junction of SVC with the right atrium. Right? SA node lies at the junction of SVC with the right atrium. I hope this is clear to all of you. Bolo bachon, is this clear to all of you? Once again, quickly, I'll just repeat what I've told you. Have a look, understand. So, this is the right atrium. A line joining the SVC to IVC. A line joining the SVC to IVC from outside. इसे क्या बोलते हैं? Sulcus terminalis. अब same line from inside is known as crista terminalis. It divides the right atrium into a rough part and a smooth part. The rough part shows structures similar to teeth of a comb. What is this known as? Comb, kangi. This is known as musculae pectinati. The smooth part shows 3 openings. 1 is the opening of SVC. 2nd is the opening of IVC, which is guarded by eustachian valve. 3rd is the opening of coronary sinus, which is guarded by Thebetian valve. ये है Thebetian valve. That's the interatrial septum. This depression is known as fossa ovalis. And ये जो elevation आप देख रहे हो, this elevation is known as limbus fossa ovalis. Limbus fossa ovalis. ये fossa ovalis को कौन represent करेगा? Who represents the fossa ovalis? Septum primum. ये याद रखना. And who represents the limbus fossa ovalis? The septum secundum. Septum secundum. Is this clear? Now this is the triangle of Koch. Triangle of Koch. Who lies in this triangle? AV node. And what are the boundaries of this triangle? 1 is the septal leaflet of the tricuspid valve, opening of coronary sinus, and 3rd is the tendon of Todaro. Tendon of Todaro. And last, the SA node lies at the junction of SVC with the right atrium. Okay, I hope this is clear to all of you. Okay, students, so let us proceed now to the next MCQ. Answer this. बोलिए. Yes, any guesses? A 40-year-old woman complains of swelling in front of the neck. Biopsy revealed a papillary carcinoma. She undergoes hemithyroidectomy. The lesion is removed with clear margins. However, during surgery, a structure lying adjacent to the inferior thyroid artery at the lower pole of thyroid is damaged. Tell me which is, there's something which goes with the inferior thyroid artery at the lower pole. Kaun hai? There's a nerve. There's a nerve which goes with the inferior thyroid artery. What is that nerve? Anyone? Can you answer this? What is that nerve which goes with the inferior thyroid artery? That's the recurrent laryngeal nerve. Recurrent laryngeal nerve, yes. Nahi, recurrent hai bacha. That's recurrent laryngeal nerve. With the inferior thyroid artery goes the recurrent laryngeal nerve, and at the superior pole of thyroid, there's a superior thyroid artery, and there's a nerve which goes with the superior thyroid artery. What is this nerve? Anyone? This nerve is the external, this nerve is the external laryngeal nerve. Yes, external laryngeal nerve. I hope you're following this. External laryngeal nerve and recurrent laryngeal nerve. Okay, have a look at this. I'll just write this down. Don't leave the page and go immediately. Yeah, this is all very important. आप देख लो. ये ना flow charts हमेशा याद रखना. I'm making a flow chart for you. Just remember this flow chart, बच्चों. Remember this flow chart. This flow chart is very important. Okay, I'll start with this flow chart. That's the vagus. Okay. Vagus nerve. Vagus gives two main branches. If you remember this flow chart now, बहुत सारे MCQs clear हो जाएंगे आपके, बहुत सारे MCQs. Okay, vagus gives two main branches. One is the superior laryngeal nerve and the other one is the recurrent laryngeal nerve. Superior laryngeal nerve is a nerve which pharyngeal arch? Fourth. And recurrent laryngeal nerve is a nerve sixth pharyngeal arch. ठीक है ना? Superior is fourth and recurrent is sixth. Superior laryngeal further divides into an external laryngeal nerve and internal laryngeal nerve. External and internal laryngeal nerve. The external laryngeal nerve accompanies the superior thyroid artery. So the external laryngeal nerve accompanies the superior thyroid artery. What does it supply? It supplies the cricothyroid muscle. So who supplies the cricothyroid? That's an extrinsic muscle of the larynx, and this is supplied by external laryngeal nerve. And what is the action of cricothyroid? It tenses. It's a tensor of vocal cords. Cricothyroid is a tensor of vocal cords. And students, when the vocal cords are tensed, what do we get? We get a high-pitched voice. A high-pitched voice. You shout in a very high-pitched voice. This is when the vocal cords are tensed. Okay. And this tensor of vocal cords is called cricothyroid. And which is the nerve supplying cricothyroid? External laryngeal nerve. And this external laryngeal nerve accompanies an artery named the superior thyroid artery. So if this external laryngeal nerve is damaged, the tensor action of the vocal cords is lost. The person cannot talk in a high-pitched voice. And this is what we call as loss of timbre of the voice. Matlab damage to this leads to loss of timbre of the voice. Timbre is the pitch. Pitch of the voice is lost. ये बहुत important MCQs है. I am writing it so it will be very easy for you to remember and understand बच्चों. ठीक है? Now, internal laryngeal nerve. अब internal laryngeal nerve is sensory. ये sensory है, ये motor है. Internal laryngeal nerve supplies mucous membrane. Sensory है ना? It supplies the mucous membrane of the larynx about the vocal folds, about the vocal cords. It also supplies, बस ये flow charts याद रखना. It also supplies posterior most part of the tongue, and epiglottis. It also supplies the posterior most part of the tongue and epiglottis, because the posterior most part of the tongue and epiglottis is derived from fourth pharyngeal arch. ये याद रखना. Recurrent laryngeal nerve. This is a mixed nerve. It supplies all the muscles of larynx. Okay, it supplies all the muscles of larynx except cricothyroid. And it supplies sensory supply or it supplies mucous membrane, ऐसे लिखना, so there's no confusion. Mucous membrane below the vocal cords. Below the vocal cords. Okay, it supplies all the muscles of the larynx except cricothyroid. It supplies sensory supply below the vocal cords. It accompanies inferior thyroid artery, and damage to this recurrent laryngeal nerve leads to hoarseness of voice. Hoarseness of voice. I hope this is clear to all of you. Okay, so damage to this nerve, recurrent laryngeal nerve, leads to hoarseness of voice. Perfect. Just remember this flow chart. Plenty of MCQs gets cleared with this. So in short, I have told you the nerve supply of larynx. Yeah, nerve supply of larynx. So all the muscles of larynx are supplied by a recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. Sensory supply of larynx above the vocal folds is internal laryngeal, below the vocal folds is recurrent laryngeal nerve. Perfect. Now come back to the MCQ. I'll clear this. Right. So voice pitch limit. So what is the answer for this? Answer होगा hoarseness of voice. इसका answer होगा hoarseness of voice. है ना? Answer for this is hoarseness of voice. When do you get this voice pitch limitation? Option A. When you get option A, damage to. Answer. Very good. So answer for this is D. When you get A कब होगा? Damage to. Students. Voice pitch of the voice is lost. Which muscle is paralyzed? बच्चों बोलो ना. Which muscle is paralyzed? Cricothyroid. Cricothyroid is paralyzed. No, voice pitch is lost. मतलब cricothyroid is paralyzed. Which nerve is damaged? The external laryngeal nerve is damaged. The muscle paralyzed is cricothyroid. Okay, very good. So voice pitch is lost. Ineffective cough reflex है ना, ये जो cough reflex है, that is mediated by internal laryngeal nerve. So if the internal laryngeal nerve is damaged, because it is going to supply the sensory supply of the larynx above the vocal folds, so if the internal laryngeal nerve is damaged, that cough reflex is lost. That's internal laryngeal nerve damage. A very important MCQ, bachcho, this is a very important MCQ. Try to understand each and every options of it. Weakness of shoulder shrug. Answer this. Who helps in shrugging of shoulders? Who helps in shrugging of shoulders? This. Shrugging of shoulders is done by whom? Trapezius. Very good. Shrugging of shoulders done by trapezius. And which is the nerve which supplies the trapezius? Nerve supplying the trapezius is hypoglossal nahi hai bacha. Richard, no. Which is the nerve supplying the trapezius? You should know this. That's anyone? Spinal accessory. Very good. It's spinal accessory nerve. Nerve supplying the trapezius is spinal accessory nerve. Which other muscle is supplied by spinal accessory nerve? Just going further. Which other muscle is supplied by spinal accessory nerve? Anyone? Trapezius is supplied by spinal accessory. Followed. Agreed. Which other muscle is supplied by spinal accessory nerve? Sternocleidomastoid. Very good. And ये जो spinal accessory nerve है ना, it lies on a muscle. It lies on which muscle in the posterior triangle? The spinal accessory nerve lies on. If you can answer this, which muscle? No, the spinal accessory nerve lies on which muscle? You can guess, bachcho, you can guess. When you make a mistake, you'll always remember that. क्या बोल रहे हो? Levator scapulae. Yes. Very good, Karnati. That's levator scapulae. So, एक minute, listen here. The spinal accessory nerve first supplies the sternocleidomastoid. ये sternocleidomastoid है. It first supplies the sternocleidomastoid. Comes in the posterior triangle of the neck. Lies on levator scapulae. It lies on the levator scapulae and it goes to supply the trapezius. Fine? Very good. चलो, ये MCQ clear है ना? every option is important, bacha. Every option is important for you. So I've told you everything in this. Okay, great. We'll go to the next MCQ. Here we go. Boliye. Another very important MCQ for you children. Which of the following is not a branch of first part of maxillary artery? बोल सकते हो, you have to know the branches of maxillary artery. Anyone? What is the answer for this? Greater palatine. Very good, very good. Answer is greater palatine. वैसे बोलो maxillary artery is a branch of what? Maxillary artery is a branch of. Can anyone answer this? Maxillary artery is a terminal branch of. Answer is D for that. Maxillary artery is a terminal branch of. Bolo, 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 students. Whatever you know, you answer. Even if it is wrong, it's okay. It's between only you and me, Okay, the maxillary artery is a terminal branch of external carotid artery. Very good. It's given in this gland. यहाँ पे gland है ना, parotid gland. This maxillary artery is given in the parotid gland. Up this maxillary artery goes deep, deep to the ramus of the mandible. ये ramus है ना, ramus. It goes deep to the ramus of the mandible, and then it reaches the infratemporal fossa. Understand each and every point that I'm telling you. Maxillary artery is a terminal branch of external carotid artery given in the parotid gland. Second point, it goes deep to the ramus of the mandible, comes in the infratemporal fossa. Now this maxillary artery is divided into three parts by, you should know this. कौन है वो muscle? एक muscle है which is going to divide the maxillary artery into three parts. Anyone? Which is that muscle which divides the maxillary artery into three parts? This muscle is the lateral pterygoid. Lateral pterygoid. So the lateral pterygoid muscle divides the maxillary artery into three parts. जैसे axillary artery is divided into three parts by whom? Pectoralis minor, है ना? Subclavian artery is divided into three parts by whom? Anyone? Answer this. Axillary artery is divided into three parts by pectoralis minor. Subclavian artery is divided into three parts by whom? बोल सकते हो? Anyone? Scalenus anterior. Scalenus anterior. Remember this, huh? वैसे maxillary artery, very good करना थी, very good. So maxillary artery is divided into three parts by lateral pterygoid. So what are the branches of the maxillary artery? Maxillary artery gives the maximum number of branches. 15 branches देता है, 15 branches of maxillary artery. Just understand how to remember this. First part gives deep auricular artery. Deep auricular. Second, anterior tympanic. Deep auricular, anterior tympanic. Middle meningeal. Next is accessory meningeal, middle meningeal, accessory meningeal, and inferior alveolar. Inferior alveolar. You know this. ये तीन arteries तो आपको पता है. Deep auricular and anterior tympanic. This goes to the ear. ये ear में जाते. Tell me, middle meningeal artery goes through which foramen? It enters the skull through. बच्चों बोलो. Middle meningeal artery enters the skull through which foramen? Accessory meningeal artery enters through which foramen? Answer. हाँ, ये middle meningeal नहीं. Middle meningeal artery goes through which? Foramen spinosum है ना ये. Foramen spinosum. Accessory meningeal artery goes through foramen ovale. Foramen ovale. And this inferior alveolar artery enters the mandibular foramen. It enters the mandibular foramen. Inferior alveolar artery enters the mandibular foramen. ठीक है? So middle meningeal artery enters the foramen spinosum, accessory meningeal artery enters the foramen ovale, and inferior alveolar artery enters the mandibular foramen. Second part of maxillary artery corresponds to, how do you remember बच्चों? Second part of maxillary artery corresponds to the anterior division of mandibular nerve. Understand it? सेकेंड पार्ट ऑफ मैक्सिलरी आर्टरी जो है ना, इट करिस्पॉन्ड्स टू एंटीरियर डिविजन ऑफ मैक्सिलरी नर्व. सो एंटीरियर डिविजन ऑफ मैक्सिलरी नर्व के ब्रांचेस, इफ you know the branches of second part of maxillary artery. So what are the branches of anterior division of mandibular nerve? One, masseteric nerve, deep temporal nerve, the nerve to the lateral pterygoids and buccal nerve. ये चार nerves है. So same नाम के arteries होती है, same other arteries. One is the masseteric artery, deep temporal artery, masseteric artery, deep temporal artery, artery to the pterygoids, and the last one is buccal artery. So masseteric artery, deep temporal artery, artery to the pterygoids and buccal artery. These are the branches of anterior division of mandibular nerve. Same है maxillary artery के second part के branches. अब difficult is third part. Third part is सबसे बड़ा part and there are plenty of branches from the third part. Third part के branches, one, posterior, I'm writing here on this, posterior superior alveolar, second, infraorbital, posterior superior alveolar, infraorbital, greater palatine, pharyngeal artery, artery of pterygoid canal, and the sixth is sphenopalatine. So these are the branches: posterior superior alveolar, infraorbital, the greater palatine, the pharyngeal artery, artery of pterygoid canal, and the sphenopalatine. Okay students, एक MCQ आया था, pharyngeal artery is a branch of what? Pharyngeal artery is a branch of what? And students have answered this as external carotid artery. Tell me students, what is wrong in that? Pharyngeal artery is a branch of, ठीक है, students ने आंसर किया external carotid. Is there a branch of external carotid artery with the name pharyngeal? ऐसा कोई branch है? Is there a branch of external carotid with the name pharyngeal in it? बोलिए बच्चों. हाँ, that's ascending pharyngeal. Very good. External carotid का जो branch है ना, that is ascending pharyngeal artery, and this is pharyngeal artery. No confusions. So ascending pharyngeal artery is a branch of external carotid, and pharyngeal artery is a branch of maxillary artery. Is this clear to all of you? Okay, so we proceed to the next MCQ. Look at this slide. Come on. This is a good slide. ये देखिए. Tell me students now, what is this artery? Answer now, what is this artery? Come on. What did you know? You answer. This is the external carotid artery. है ना, ये external carotid artery है. This is external carotid. So you can see those two terminal branches of external carotid now. So what is this artery? ये जो ऊपर जा रही है, this is the superficial temporal, and what is this now? Maxillary artery. That's the maxillary artery. So what is this part of the mandible? This part, ये ऐसे होगा. This is the ramus of the mandible. The maxillary artery goes deep to the ramus of the mandible. And what is this muscle? ये क्या muscle है? This is the lateral pterygoid muscle. And this maxillary artery is divided into three parts by lateral pterygoid muscle. So what is this area now? ये है infratemporal fossa. यही है infratemporal fossa. What is this artery here? This is the maxillary artery. What is this muscle? Lateral pterygoid. What is this muscle? Can anyone answer this? What is this muscle here? This one. This muscle is the medial pterygoid. What is this nerve? And what is this nerve? Can anyone answer this? What is this nerve? You can see an artery which is entering into this foramen. Masseter नहीं है. Masseter बाहर होता है. Masseter is outside here. Masseter is not that. This is medial pterygoid. अंदर है ये. अंदर की तरफ है. It's inside. It is inserted on the angle inside. That's medial pterygoid. Okay, bahar hoga masseter. What is this nerve? Can anyone tell me what is this nerve? This is the inferior alveolar nerve. Very good. This is inferior alveolar. What is this nerve? This is the lingual nerve. Lingual nerve. Okay, so that's the lingual nerve. That's the inferior alveolar nerve. Inferior alveolar nerve. And this is the inferior alveolar artery, which is entering into the mandibular foramen. Entering into the mandibular foramen. Okay, fine. So that's about the maxillary nerve. We'll come to the next MCQ. Identify this histological slide. Identify this histological slide. Anyone, can you identify this slide? Yes. Histological slide. This is a slide of lymphoid tissue. I'm giving you a hint. It's a slide of lymphoid tissue. Abhi bolo. It's a slide of lymphoid tissue. Nahi? Can't answer. This is a slide of thymus. Thymus hai ye. Thymus. This is a histological slide of thymus. In thymus, the lymphoid follicles. है ना, कोई भी slide lymphoid tissue का slide आप देखोगे, any slide of lymphoid tissue you see, you get such rounded follicles. What do you call these follicles? As lymphoid follicles. Okay, look at this slide. You get such lymphoid follicles in the slide of lymphoid tissue. है ना, ये देखिए, these are the lymphoid follicles. We have got 4 slides of lymphoid tissue. 4 slide है. 1 lymph node, spleen, tonsil, thymus. Lymph node, spleen, tonsil, thymus. 4 slides है. In all the slides, we get this lymphoid follicles. ये lymphoid follicles देख रहे हो? Except in one tissue, the lymphoid follicles are absent. What is that? Thymus. Thymus. So lymphoid follicles are absent in thymus. That's an MCQ for you. Lymphoid follicles नहीं होते thymus में, they are absent. So thymus में capsule होता है, capsule, and from the capsule you get septa. Septa. The septa will divide the thymus into lobules. Lobules. This is one thymic lobule, that's the second thymic lobule, third thymic lobule. As these are different lobules. Each lobule has got an outer cortex. ये बाहर cortex है, and inner medulla. You can see this medulla inside. बाहर cortex है, inside is the medulla, and in the medulla you get such rounded structures. What are these rounded structures known as? These are the Hassel's corpuscles. Hassel's corpuscles. This Hassel's corpuscles are characteristic of what? Thymus. Okay, so this is thymus. What is this? This is white pulp. This is white pulp, and all this is red pulp. This is all blood. This is red pulp. This is white pulp. This is spleen. Spleen. And in spleen, you get this arteriole, which is pushed to the periphery. We call this as eccentric arteriole. Eccentric arteriole. What is this? You get a capsule, and capsule के नीचे space होती है, and these are the lymphoid follicles here. All the lymph is filtered in this space. This space is known as the subcapsular sinus. Subcapsular sinus, that's a lymph node. And the last, you get such crypts like this. ये देखिए, you get such crypts like this. And what is the epithelium lining the crypts? It's stratified squamous non-keratinized epithelium. The one which lines the crypts, that's stratified squamous non-keratinized epithelium. So this is a slide of tonsil. Okay, so tonsil में crypts मिलते हैं, crypts, and the epithelium lining the crypts is going to be stratified squamous non-keratinized epithelium. So this is a slide of tonsil. Are you able to follow this? Students, are you able to follow this? What we'll do is I'll just brief you about our platform, and then we come back to our MCQs. Now students, we've got a plus subscription in which you've got daily live classes, live quizzes, learning from the top educators, study from the device of your choice, and you can access to our question bank with some 25,000 plus MCQs. An iconic subscription where you get the best of Unacademy and pre-planner. Some special class features in which there's interactive live class, there's poll for the learners, there's raise a hand technique, never miss a class with proper notifications being given. lecture notes. If you miss the class, you get this recorded sessions, you get the notes, and anytime, anywhere you can access the class and get your doubts solved. A highly effective and updated question bank has been prepared with the latest MCQ and the detailed explanatory answers specially for you. These are our NEET PG toppers who have got very good ranks in the recent NEET PG exam. We congratulate all of them. Now students, there's a NEET PG Compact specially for you. You can tell your friends also, and there are a lot of prizes to be won. So you might get a free subscription, you might get a free Amazon voucher. So tell your friends also. When is the date? Don't forget the date. It's 28th November 5 p.m. You can tell your friends also 28th November 5 p.m. It's a free test, students. Give this, crack this test, okay? Enroll for this test. It's the Unacademy PG, NEET PG Compact. Raise a hand technique. If you press the icon, you can directly talk to the educator. Now, look here, we have got rituals. Like, we've got tests on specific timings, on specific days. So, Wednesday 9 p.m., it's an educator curated test series. Like, it's a subject-wise test, which the educator has prepared for you. On Friday 9, it's Study With Me on YouTube. It's a test series. On Saturday 9, it's a marathon test series. And Sunday 10 a.m, there is a grand test. NEET, INI-CET and FMGE grand test. Okay. Now students, we're starting with 2 new batches. Yes, a Focus FMG 2022 batch and Target NEET PG 2022 batch from 24th of November. 24th of November. Download the Unacademy app and subscribe to it. Okay, fine. We come back to our MCQ. Chalo, start. Answer this. All this contains of spermatic cord except. Anyone? Answer this. All other contents of spermatic cord except. Testicular artery. Very good, very good. The answer is testicular artery for this. Testicular artery is not a content of spermatic cord. Testicular artery directly goes. And a testicular artery hai na baba, sorry. Testicular artery is there. Testicular artery is there. What is the answer for that? Sorry. The answer is ilioinguinal nerve. Ilioinguinal nerve. Ilioinguinal nerve is not inside the spermatic cord. Ilioinguinal nerve is in the inguinal canal, but it is outside the spermatic cord. It's outside the spermatic cord. Correct? It's outside the spermatic cord, but it's within the inguinal canal. That's ilioinguinal nerve. So what are the contents of spermatic cord? What are the contents of spermatic cord? One is the vas deferens, the main content, the vas deferens, artery to the vas, vas deferens, artery to the vas, testicular artery, cremasteric artery. There's a plexus of veins. What's that? Pampiniform plexus of veins. That's the genital branch of genitofemoral nerve. And there's lymphatics from the testis. All these things are put together, all these things are tied together, and this becomes the spermatic cord. Okay, so what are the contents of spermatic cord? One, the vas deferens, the artery to the vas, the testicular artery, the cremasteric artery, the pampiniform plexus of veins, the genital branch of genitofemoral nerve, and the lymphatics. All these things are put together, all these things are tied together. That's a spermatic cord. Where does the spermatic cord lie? In the inguinal canal. The contents of inguinal canal kya hota hai? Spermatic cord and ilioinguinal nerve. Okay, so ilioinguinal nerve is outside the spermatic cord, but it is inside the inguinal canal. In females, what are the contents of the inguinal canal? It's the round ligament of uterus and the ilioinguinal nerve. Round ligament of uterus and the ilioinguinal nerve. Okay, so testicular artery is a lateral branch of abdominal aorta. Testicular artery. It's a direct branch of abdominal aorta. It's a lateral branch of the abdominal aorta. Which are the other lateral branches of abdominal aorta? Can anyone answer this? Branches of abdominal aorta. Okay, I'll just quickly go through this. You tell me. Agar aapko pata hai to answer this first. Branches of abdominal aorta. This is another very important thing, and this you should know. Branches of abdominal aorta, how do you divide this? 2, 3, 4 and 5. So what are two? Two are terminal branches, two terminal branches at L4. And what is that? Common iliacs. Two terminal branches at L4, that's common iliac. What is 3? 3 is ventral branches. Ventral branches. What is the first ventral branch? Celiac trunk. ये अपन ने देखा, what is at what vertebral level is it? T12. And what is its supply? Foregut, celiac trunk. The second is superior mesenteric artery. What is the vertebral level? L1. And what is its supply? Midgut. And the last one is inferior mesenteric artery, hindgut, and level is L3. This is L1 vertebral level, this is L3. 4 are lateral branches. Lateral branches. So which are the lateral branches of abdominal aorta? Now this you have to know. The first one is inferior phrenic artery, inferior phrenic. Second is middle suprarenal, middle suprarenal. Third is renal, and the fourth is gonadal. And 5 are dorsal branches. 5 dorsal branches. उसमें 4 pairs of lumbar arteries, 4 pairs of lumbar arteries, and 1 median sacral artery. 4 pairs of lumbar arteries and 1 median sacral artery. That's the easiest way to remember the branches of abdominal aorta. Okay, that's the easiest way. How do you remember this? 2, 3, 4, 5. दो क्या होते हैं? दो terminal branches होते हैं. Where does the aorta divide? At what vertebral level does the aorta divide? Another very important for your MCQ, for you students, it divides at L4. It divides at L4 into 2 common iliacs. 3 ventral branches. Which are those ventral branches? The first one, celiac trunk. What's the vertebral level? T12. What is its supply? Foregut. Second ventral branch, superior mesenteric. Vertebral level L1. What is its supply? Midgut. Third is inferior mesenteric. Level L3. What is its supply? Hindgut. 4 lateral branches. The first one going to supply the diaphragm from the inferior aspect. What's that? Inferior phrenic artery. Second is the middle suprarenal artery. Middle suprarenal artery. Third is renal. And the fourth one is gonadal artery. Gonadal होगा testicular or ovarian. And 5 dorsal branches, जिसमें there are 4 pairs of lumbar arteries. See, lumbar vertebrae कितने होते हैं अपने पास? 5. We have got 5 lumbar vertebrae. But the aorta does not supply 5 lumbar vertebrae. Aorta is only going to supply 4 lumbar vertebrae. Why students? Because it divides at L4. Aorta divides at L4, no? So aorta will supply only 4 lumbar vertebrae. L1, L2, L3, L4. And these are by lumbar arteries. Lumbar arteries. So 4 pairs of lumbar arteries, and there's one artery which runs in the midline of the sacrum. What's that? Median sacral artery. One is the median sacral artery. So you have 4 pairs of lumbar arteries and 1 median sacral artery. So एक lumbar vertebrae बाकी है to be supplied. 1 lumbar vertebrae is left. Who's that? L5. And L5 is supplied by iliolumbar artery. Iliolumbar artery. Iliolumbar. L5 है ना? L5 बाकी है. L5 is supplied by iliolumbar artery. Just remember that. So aorta supplies 4 lumbar vertebrae. 1 lumbar vertebrae is left. That's L5, which is supplied by iliolumbar artery. And this iliolumbar artery is a branch of internal iliac. Iliolumbar artery is a branch of posterior division of internal iliac. Posterior division of internal iliac. Okay, I hope things are clear to all of you. कुछ doubts है तो बोलिए. The session is open for doubts. I still have got 1 minute. If you have any doubts, you can ask me. Yes, students, any doubts? In today's session, I have told you many things in this session of today's. Okay, so see to that you know everything. Go through it. If you have any doubts, you can send a mail. You can send a mail, you can send a WhatsApp, anything. Okay? Fine to all of you. So thank you to all of you. Thank you, and if possible, I'll take a lecture tomorrow also for you. Let me see. Okay? So thank you to all of you. No doubts, no? If there's any doubt, you can ask me. Fine. So thank you to all of you. Bye bye. Thank you.